Hello everyone, I'm Dr. Sena from Mira Clinic. Today we're going to talk about the jawbone grafting. What is jawbone grafting? What are the different types of this procedure? Can different sources of bone really be used, like autologous, self-donated, or animal-derived bone? What about the recovery? How long does it take? And is Turkey truly a better destination for jawbone grafting compared to other countries? In this video, we will dive into all these questions and provide a clear, detailed answers. What is bone grafting? Bone grafting is a surgical technique where bone or bone-like materials are added to the jawbone to enhance its density and strength, create a very stable and solid foundation for dental implants. But does every dental implant require a bone grafting? Not necessarily. Bone grafting is typically recommended for cases where the jawbone lacks sufficient density, which can occur due to prolonged tooth loss without replacement or chronic gum disease. First, we give local anesthesia. The treatment area is numbed to make the procedure completely pain-free. Then the dentist creates a very small incision to expose the existing bone. Then placing the bone material, closing the incision to protect the area and facilitate healing. What are the types of jawbone grafting procedure? There are several types of jawbone grafting procedure. The most common type include Sinus Lift. This procedure is used when there is insufficient bone height in the upper back jaw. Second, the block bone grafting. In this method, a small block of bone is taken from another part of your body, such as the jaw or the chin, and transplanted to the area needing reinforcement. Third one is socket graft. After tooth extraction, the bone graft material is immediately placed into the socket of the extracted teeth. This helps preserve bone density and ensures a solid base for future dental implant. What types of bone are used in jawbone grafting? The main types are autograft, patient's own bone. The bone is harvested from the patient's own body, typically from the jaw or other area like the hip. Second, allograft, bone from a donor or bone bank. Third, xenograft, animal-derived bone. And alloplast, synthetic bone, made from synthetic material, such as hydroxyapatite or tricalcium phosphate. The main advantages: there is no need for surgery to harvest bone, safe and biocompatible with the human tissues. How to choose the right option? The most suitable type of bone graft material depends on the patient's health, the extent of bone loss, and the treatment goals. Your dentist will determine the best option to ensure the success of your procedure. Recovery and aftercare following bone grafting. Recovery from bone grafting varies based on factors like your overall health, the type of procedure, and its complexity. The grafted bone integrates with your jawbone through a process called osseointegration, which typically takes several months. In the first few days, you might have mild symptoms such as swelling or slight discomfort, but these generally fade as healing progresses. How to care for yourself after bone grafting? Proper aftercare is key to ensuring a smooth recovery. Here's how you can take care of yourself. First, practice a good oral hygiene. Minimize physical effort to reduce the pressure on the jaw. Eat soft foods. Attend follow-up appointment. Now we're going to talk about potential risk or complication of bone grafting. While bone grafting is generally safe, there are some potential risks to be aware of, such as infections. Poor sterilization or insufficient post-operative care can lead to an infection at the surgical site. Graft failure. In rare cases, the grafted bone may fail to integrate with the jawbone. And nerve damage. If the grafting is performed near the major nerves, it could cause temporary or permanent numbness. However, by following your dentist's instruction and choosing an experienced specialist for the procedure, these risks are significantly reduced. Is bone grafting painful? Some mild discomfort or soreness expected after the procedure, especially during the first few days. This is typically well managed with painkillers proper care, and attention. Most patients experience a smooth recovery with a minimal pain. Why choose bone grafting in Turkey? Because of the highly skilled dentist, state-of-the-art technology, and affordable pricing compared to Europe or the USA. Comprehensive services for international patients. Turkish clinics go above and beyond to accommodate international patients by providing translation services, arranging transportation, and assisting with accommodation. What is the cost of bone grafting in Turkey? The cost of bone grafting in Turkey can vary depending on several factors, such as complexity of procedure, type of bone graft material, clinical reputation, and expertise. We hope this overview of bone grafting has provided clarity and answered your questions. Thank you for watching, and we wish you a smooth and successful journey toward restoring your oral health and achieving the smile you have always wanted.